Kia ora, nau mai haere mai ko Erika Tokungawa. Welcome to Te Papa Hauora Spotlight series on healthcare innovators, where we showcase our people behind healthcare innovation in Canterbury. The series is brought to you by Te Papa Hauora Health Precinct in conjunction with VIA Innovations in Christchurch, New Zealand. My name is Erika Austin and I'm the host of the series. We hope you enjoy hearing about how our guests were encouraged to become healthcare innovators as they share their innovation story and insights on what they're seeing about the new ways of working or new products that have been adopted or invented during the pandemic. Today, we're chatting with Professor Anthony Butler, a clinical radiologist with an interest in developing new imaging technologies. Together with his father, Professor Phil Butler, they co-founded Mars Bioimaging. I first met Anthony and Phil in 2018 when they spoke about their work at TEDx Christchurch. I thought your name looked familiar. Tēnā koe, Anthony.
Morena.
You're super involved in the healthcare innovation ecosystem locally and globally. Please tell us a little bit about your journey and how you became interested in this space.
Well, it wasn't a planned journey. I left school completely unsure about what I wanted to do in life, and ended up studying technology. I did maths and physics, and then later an engineering degree. And in parallel, I did medicine and a medical specialty. And I guess I reached my early 30s, unsure what I wanted to do, but was super enjoying medical technology and innovation. And I was lucky enough to find a niche where I could actually contribute and do something worthwhile.
So what has inspired you either locally or globally about what you've seen happening in the health tech industry during the pandemic so far?
Well, one of the things I think that's fascinating is technology really solves a lot of problems in the world. And when I first got into what we call spectral photon counting about 10 or 15 years ago, it was clearly a new technology that was going to change the way we did imaging entirely. You could do stuff that you could do on CT, but you could also do some things you could do it on MRI and some things you could do on PET imaging. But you could do it in a low radiation way. And more importantly, and I think this has really come out through the pandemic, you can start providing technology to the community. So instead of imaging technology being bound to hospitals and tertiary referral centres, you can produce machines that can sit in the community, that can go to Gisborne or the West Coast and really get the technology to where the people are. And I think that's really kind of exciting, because better delivery of healthcare through technology will actually improve people's lives.
Let's spend some time on Mars Bioimaging and how you got around founding the organization in 2007. Am I right? What is it, and what do you see as value?
2007 is when we officially founded the company. My father at the time had been head of the New Zealand contingent at CERN doing detectors for discovery of the Higgs boson. And I'd actually just finished my clinical training in radiology, and I'd done my PhD in machine learning and was looking for where to go to next. And he encouraged me to go to CERN and see some of the new detectors and new technology coming out from there. At the time, we got some money from the Tertiary Education Commission to set up a research program in New Zealand, really to foster PhD students and education in the city, and link together the universities, the Polytech and the hospital, looking at new ways of doing imaging. It's been a fascinating journey, because like a lot of health tech, we've had to have computing, mathematics, electronics, as well as pathology, biochemistry, and clinical specialties like medicine and surgery. So it's a really exciting space to be working in. It's quite enjoyable going from a discussion with mathematicians about reconstruction techniques to a discussion with surgeons about how the technique can improve their patient care.
And where do you see the value of what you're doing?
I think the value of it is that by having an imaging technology that can go out to the community and provide that information that CT and MR and PET can provide, you're allowing patients to get a diagnosis earlier in their care pathway. So it's at the right time and the right place. So you end up with a more efficient system. So that's better for the health funder, for the government or ACC, as we have in New Zealand. But for the patient, it actually means there's less waiting around. They get their diagnosis earlier and they get treated earlier. So it's kind of a win-win. And so I think, technology is really good about, you improve the lives of the patient, but you tend to also make the health system more efficient.
I love it, using technology to improve the lives of people. And so what's unique about Canterbury, the region, that makes it so great for innovators such as yourself?
Actually, this is something I've only sort of discovered as we got going, and realized how good we are at innovation compared to other places. Canterbury, we're about the right size in that we've got big universities, we've got a lot of tech companies, but we're not so big we become siloed. So it's really easy to get multidisciplinary research and development going. It's very easy for someone here to go and talk to an electrical engineer, and then the next day go and talk to a professor of medicine. Whereas if you're a larger overseas place, you tend to find things are much more siloed. People are much more interested in the way they work. Whereas we're kind of at the sweet spot in size where we've got all the skills and all the resources that you need, but we're small enough that people know each other and can communicate well.
And speaking about local support in Canterbury, what's something specific that has helped for Mars bioimaging, for example, like testing the technology?
Well, we've been able to interact with the clinicians and the patients really easily. So at the moment, we're working with Bishop Radiology to do clinical trials. And it's been very easy to organise that in a city the size of Christchurch, because you know everybody. You'll have known them from other projects or social gatherings or education courses you've been on together. So it's very easy to get stuff going. And when you need something solved, you probably know which local business has that particular skill or which person in the university has that particular skill. So it's been very efficient to getting stuff working.
Collective impact and collaboration jumps out while just listening to you. So from your experience, what is the key to good collaboration?
This is actually something my father taught me years ago. You want to collaborate with someone who's working in an adjacent field to you. So you don't want to be working with someone who does exactly what you do. You want to be working with someone where what you do helps them and what they do helps you. And usually that's where you get the strongest sort of synergies or acceleration for both people. For us, that means working with radiologists and the difficulty they have with community diagnoses, because we can help them provide better service to their patients. Similarly, for us, we have access to resources that we otherwise wouldn't get.
So with this series, we want to create what we call social proof to inspire others to get involved. What would be your top advice for someone beginning their healthcare innovation journey here in Canterbury?
I think the best thing to do is to just go and talk to people. And it's an incredibly open environment. Without talking too much about overseas places, one of the things you can do in New Zealand, and I've noticed people doing with me, I get phone calls from students or members of the public, and we're small enough that we have the time to talk to everyone and help them along and make introductions. And I think that's really nice. So actually, it's a very supportive environment. Yeah, what's my top advice? Get out and start talking to people, because you'll actually find people are very helpful.
Yeah, and have meaningful conversations about what you're interested in, and you'll find people that are willing to support you. So Thank you so much for joining us today, Anthony. It's been wonderful to hear from you and your journey in the healthcare innovation space. My name is Erica Austin from EA Curation. I'm a connector, facilitator, activator, and storyteller based here in Canterbury. The series is brought to you by Te Papa Hauora Health Precinct in conjunction with Via Innovations and Christchurch NZ. To watch our other interviews in the series, please visit the links shown below. And for more information about the series, please contact the team at Te Papa Hauora Health Precinct using the email here. Ngā mihi nui, ka kite anō.